वेट है वो थर्ड एम्पायर है, वो आ तो गए एज अटेंडी, लेकिन उनको मैं
यार
प्रमोट
थर्ड एम्पायर को तो रहने दो।
शुरू कर दें सर, है ना, तो वो बाद में ज्वाइन करेंगे।
वेरी राइट सर।
एम्पायर कौन कौन है हमजा?
सर अंपायर आप ही हैं।
यार थर्ड एम्पायर का कह रहे थे। चलिए बिस्मिल्लाह करें यार।
So we are just starting with this video of Cardiac Super League.
ये साउंड नहीं आ रही है।
इसकी आवाज नहीं आ रही वीडियो।
एक आई सजेस्ट आप ऐसा कर सकते हैं कि विल स्टार्ट द प्रोग्राम, तो आप ये वीडियो को सॉर्ट आउट कर लें, तो हम जो बीच में दो टीम्स के बीच में ब्रेक होगा उस वक्त इंटरमिशन, उस वक्त इसको रन कर लें। आप म्यूट हैं, आपको अनम्यूट करना होगा।
सही है सर, प्रोग्राम शुरू कर दें प्लीज।
Assalamu alaikum everyone. I'm Hamza Hussain on behalf of Wilson's Pharmaceuticals. I'm honored and privileged to extend a very warm welcome to all of you in the opening session of Pakistan Cardiac Society's Cardiac Super League. First, I would like to introduce senior faculty members of Cardiac Super League. We have with us Chairperson of Cardiac Super League, Professor Feroz Memon. Feroz Memon is the scientific chair, is a scientific council, is a chairman scientific council cardiovascular research and academic program for Pakistan Cardiac Society. He is also vice chancellor and professor of cardiology at the University of Modern Sciences, Sando Muhammad Khan. From the president-in-chief, we have with us Pakistan Cardiac Society President Professor Javed Akbar Sayal. He is professor of cardiology and executive director at National Institute of Cardiovascular Diseases. And from the governing council, we have with us Professor Dr. Khawar Kazmi. He is consultant of preventive cardiology at National Institute of Cardiovascular Disease, and he is also the moderator of this first match between NICVD Kings and PIMS Leopards. And from the umpire, we have Professor Dr. Mohammad Isad. He is professor of cardiology at Karachi Institute of Heart Disease, and he is also chairperson of International Society of Hypertension Advisory Group of South and Central Asia. And from third umpire, we have with us Professor Tariq Ashraf. He is also the head of review committee of Cardiac Super League, and he is third umpire of today's match, and he is from a former professor of cardiology from National Institute of Cardiovascular Disease. So, for the opening remarks, I would request Professor Khawar Abbas Kazmi to please share his views on Cardiac Super League.
Okay, thank you, Hamza, and thank you, Wilson Pharma, for this supporting the initiative by Pakistan Cardiac Society. तो आई थिंक ये इस तरह का जो कॉन्सेप्ट है, इस तरह के इवेंट का, इट इज़ ऑलरेडी हैपनिंग इन गैस्ट्रोएंटरोलॉजी, बट इट्स फर्स्ट टाइम दैट इन कार्डियोलॉजी वी आर undertaking this kind of an event, and obviously the purpose is an academic growth and learning, एंड क्वेश्चन जो होंगे उनका फॉर्मेट जो है इट विल हेल्प द रेजिडेंट्स और ट्रेनीज इन enhancing their knowledge and also in their examination जो वो इंशाल्लाह बाद में देंगे. तो I think let's start the program and जैसे इसमें इस वक्त जो हमारे पास दो टीम्स हैं, NICVD Kings है और PIMS की Leopards हैं, तो हम पहले इनसे टीमों से तारफ कर लेते हैं. तो एक बेसिक रूल जो है वो सबको ऑब्जर्व करना चाहिए, वो ये कि इफ़ यू आर नॉट स्पीकिंग तो प्लीज़ म्यूट योरसेल्फ. अगर आप जब बोल रहे हो उस वक्त अनम्यूट करें एंड देन यू कैन स्पीक एंड देन म्यूट योरसेल्फ अगेन. So I'll start with NICVD Kings, not because I am from NICVD, but because they are Kings, so Kings से शुरू करते हैं. तो NICVD Kings आप अपना तारफ करा दें, जो आपके कैप्टन हैं वो आपको इंट्रोड्यूस करा दें और अपने टीम मेंबर्स को इंट्रोड्यूस करा दें.
Okay, am I audible? Mute तो नहीं है?
Yes, you are.
Okay.
You are, sir. Please.
Okay, so my name is Dr. Leopards Nasir. I am captain of NICVD Kings, and we are ready. And this is my team. This is Dr. Syed Danish, my team member. This is Dr. Mariam, my team member, and this is Dr. Syeda Muniba, my team member.
It's good. We'll move on to the second team. PIMS Leopards, आप अपने प्लीज इंट्रोडक्शन करा देंगे.
Assalamu alaikum. I'm Dr. Muniba. I'm the captain of the team, PIMS Leopards, and along with I have Dr. Ali Raza, Dr. Noman, and Dr. Khalil as team members.
Thank you. So best wishes to both the teams and जो हम start करेंगे तो we'll start with the toss. जो team toss जीतेगी they'll present their first case and case scenario के बाद उनके जो questions हैं 10 questions हैं हर case scenario के साथ and the other team will have 90 seconds to answer the question. 90 seconds के बाद में अगर वो आंसर नहीं कर पाएंगे तो दे विल नॉट स्कोर एनी नंबर्स. अगर रॉन्ग क्वेश्चन होगा तो ऑब्वियसली तो भी कोई रन स्कोर नहीं करेंगे, लेकिन कोई नेगेटिव मार्किंग नहीं है. 6 मार्क्स हैं फॉर ईच करेक्ट आंसर. सो दिस इज द फॉर्मेट. इसाक साहब जो है वो बेसिकली इसको आगे रन कर रहे होंगे प्रोग्राम को, और अंपायरिंग का भी सारा मेन काम जो है वो इनका ही है. मेरा काम तो यहाँ पे तक खत्म हो गया. तो इसाक साहब इट्स ओवर टू यू एंड फिर आप टॉस के लिए कह दें और टॉस हो जाए तो फिर विल स्टार्ट विद विच एवर टीम. थैंक यू वेरी मच.
Sir, before going to Isaac Sahab, may I request one thing? Because I am in Sydney, I have to go some commitment as they have requested. Wilson has requested to join it at opening, so I may leave it. अगर इजाजत हो आप लोगों की तो सर.
ओके, शुक्रिया, बहुत शुक्रिया विशाल. आई थिंक आपकी प्रेजेंस जो है वो इट वाज अ सोर्स ऑफ स्ट्रेंथ एंड वी अंडरस्टैंड. आप जाहिर है आई थिंक वहाँ होते हुए आपको पार्टिसिपेट करना, वी अप्रिशिएट दैट. And I also welcome Dr. Feroz Mehman. Assalamu alaikum, Feroz. And I think Tariq Ashraf साहब भी हैं. Assalamu alaikum. And Amber Ashraf हैं. Assalamu alaikum, Amber.
Assalamu alaikum.
जी, welcome to the first event of this Super League. So Ishaq साहब, it's over to you.
Thank you very much, Howard. I think you have made a very good start by introducing the format, and I think without wasting time, I would like to ask the teams to please toss so that who's going to bat first, we should know that.
Toss screen, sir. Sorry.
So toss कर लीजिए.
Who's call?
Electronic.
Ji sir, please NICVD are requested to please choose between head and tail.
Okay, heads.
Okay.
You
have won the toss.
You got it. आजमी साहब ने तो ऐसा नहीं शुरू किया बिस्मिल्लाह करके तो आप ही को मिल गया.
Yes, we are going to give a scenario.
Go ahead, please.
Sir, please come again. You will present your case first.
No. Do we have option?
Yeah, you have the option. Either you can present and the other team can present.
Okay, so we would like to solve their case first. We'll present later.
Okay, PIMS Leopard will be presenting first.
All right. Screen पे आएगा या?
Yes, your presentation is coming on the screen.
All right.
There you go.
Scenario वाले को.
Please go ahead, madam.
All right. A 19 years old male who is a student presents to your office with complaints of exertional dyspnea. His blood pressure is 145/88. Carotid upstroke is brisk with a secondary upstroke. S1 and S2 are normal. A loud 3/6 systolic murmur is heard along the left sternal border. S4 is audible. The murmur increases in intensity with Valsalva. Next. What is the most likely clinical diagnosis? A, aortic stenosis, B, ventricular septal defect, C, hypertrophic cardiomyopathy, D, mitral prolapse, E, athlete's heart.
And your time starts now. You can go to the first slide as well if you need any.
Okay. Okay, first कर दीजिए slide.
First slide.
Fifty seconds हो जाए तो बता दीजिएगा.
हमजा आप टाइम की क्यों कर रहे हैं ना?
Yes, sir. Timer is online. Online timer is available, sir. 30 seconds left behind.
Okay, question दिखा दीजिए. So the answer is C, hypertrophic cardiomyopathy.
Okay. Dr. Maniva, please.
Do I need to confirm or you are going to provide with the key?
Yeah, you will providing the key.
All right, it is the correct answer.
Okay. Please update the score.
Okay, you can move to the next question. I think first हो गया.
For every right answer, you will be awarded 6 runs.
Geez, so they have 6 runs now. So I think
Yes.
Leopards can go to the second question.
Yes. Second slide.
What is true regarding epidemiology and genetics of the disease? Prevalence of 1:15,000 in general population. B, complete penetrance. C, men and women are equally affected. D, autosomal recessive. E, MYH7 and MYBPC3 mutation is most common.
And your time starts now.
It's either A or E. Can we get the full form of these genes? Option E. Yeah, myosin binding protein C3 and MYH.
Myosin H7 and myosin BPC3.
Myosin H7, myosin BPC3.
Protein binding myosin है. Prevalence I don't know about the prevalence.
40 seconds to go.
Okay. Okay, so the answer is E.
Over
Correct
to
answer.
Dr. Mani. It is the correct answer.
Okay, good, Kings. I think you have successfully answered 2 questions, so 12 runs to you. आप अगला next question पे Leopards, you can go. PIMS team, आप जा सकते हैं.
Which of the following is true regarding phenotype of the disease? A, apical variant is most common. B, 2/3 of the patients present with non-obstructive cardiomyopathy. C, asymmetrical hypertrophy is rarely present. D, mitral apparatus is abnormal in addition to myocardium. E, concentric left ventricular hypertrophy rules out the disease.
Time short now.
Yeah. Yeah, it's B. 2/3 of the apical variant क्यों कह रहे हैं? A rule out, C rule out, D rule out.
Apical variant most common नहीं होता. ठीक है, asymmetrical hypertrophy हमेशा होती है, सही है. Mitral apparatus abnormal नहीं है, सही है. हो सकता है. Not necessary है ना, वही तो वाली बात है. Okay, the concentric hypertrophy rules out it. Time 45 seconds. B, तो कितने presentation दिए थे?
Don't go into the details. B formal, stay formal.
30 seconds left.
Okay, so the answer is B.
B or D?
B, ball.
Well, it's incorrect. The correct answer is D.
Okay.
Next question. Which of the following echocardiographic parameter favors athlete's heart? Left LV wall thickness more than 16 mm, asymmetric hypertrophy patron, impaired relaxation, D, LV and diastolic dimension of more than 45 millimeters, E, left atrium enlargement.
Timer is not started.
Wall thickness more than 16
Timer अभी तक started.
13 to 16 होती है asymmetrical hypertrophy pattern नहीं होता symmetrical. Impaired relaxation वैसे होती है लेकिन LV and diastolic dimension the main thing वो आपका more than 45 मिलेगा.
सही कह रहे हैं आप बोल रहे हैं क्वेश्चन.
फिर आप उसको बिल्कुल डिफरेंशिएटिंग पॉइंट उन्होंने सबसे ज़्यादा LV and diastolic dimension LA enlargement की होगी लेकिन आई एम मोर कन्विंस्ड विद LV and diastolic dimension. It is a bit too much confusion between C and D. D should be the right.
क्या impaired relaxation
45 से ज़्यादा होगा तो it is rule कि आप और more than 55 हो तो फिर आप इसको वही
लेकिन impaired relaxation किसने दी?
impaired relaxation तो किसी ने दी सकती है ऐसे ही साथ वो तो नहीं. I think it should be D.
Impaired relaxation is the
I'm sure about dimensions. Yeah, that's it.
Okay, 20 seconds.
Okay, so the answer is D. D for doctor.
D. All right, it's right.
Okay,
Next.
good. Next.
Question 5. Which of the following statement is true regarding dynamic auscultation in this disease? A. Hand grip increases the murmur. B. Amyl nitrate increases the murmur. C. Leg raising increases the murmur. D. Squatting increases the murmur. Or E. Valsalva decreases the murmur. Timer didn't start.
Timer is already on. Yeah.
प्रीलोड कम होगा
स्वेटिंग से आपका क्या होता है?
प्रीलोड बढ़ेगा
प्रीलोड
हाँ
बढ़ेगा
बढ़ेगा बिल्कुल बढ़ेगा
बढ़ेगा तो मर्मर कम हो जाना चाहिए। हैंड ग्रिप आपका आफ्टर लोड बढ़ा देगा, मर्मर कम कर देगा। लेग रेजिंग इंक्रीज करा देगा, लेग रेजिंग डिक्रीज करा देगा बिकॉज प्रीलोड कर देगा। इट्स आइदर अमाइल नाइट्रेट और स्क्वाटिंग। तो स्क्वाटिंग में दो चीजें होती हैं। देखो स्क्वाटिंग की दो चीजें होती हैं। स्क्वाटिंग आफ्टर स्क्वाटिंग आपका आधा चीज होती है ना, आपके पास लोअर के अंदर का ब्लड वापस नहीं आता पलट कर, और आफ्टर लोड वो बढ़ा देता है।
आफ्टर लोड भी कम करेगा वो
अमाइल नाइट्रेट
प्रीलोड भी कम करेगा आफ्टर लोड भी कम करेगा
आफ्टर अमाइल नाइट्रेट नहीं कमाई कम करेगा ना। हुक्म के अंदर हमेशा जब भी प्रीलोड कम होता है मर्मर इंक्रीज कर जाता है। हम जल्दी करते हैं। वेलसल्वा आपका इंक्रीज करता है मर्मर बिकॉज प्रीलोड कम हो जाता है। लेग रेजिंग आपके पास डिक्रीज करता है। हैंड ग्रिप आपके पास डिक्रीज करता है। नाउ वी आर स्टक बिटवीन बी एंड डी। आइदर अमाइल नाइट्रेट कंफर्म जो प्रीलोड और आफ्टर लोड कम करता है।
Okay, it's 15 seconds left.
अमाइल
5 seconds.
Okay, answer is B.
Is
B for
correct.
ball.
Next.
It was fun.
Good work. Close that, but you scored well. Next question.
Which echocardiographic findings go against the diagnosis of hypertrophic cardiomyopathy? A. Diastolic wall thickness more than 15 mm. B. Septal to posterior wall thickness ratio of 1:3. C. Systolic anterior motion of mitral leaflets. D. Absence of diastolic dysfunction. E. Late peaking LVOT Doppler signal.
Posterior वाला ऐसा नहीं होगा yes it should be reverse
अगेंस्ट कह रहा है, सवाल है अगेंस्ट द डायग्नोसिस।
हाँ so B is the wrong answer
ज्यादा होगी।
septal to posterior they are saying septal is
सही
lesser
है,
than
ठीक है सही है।
so B should be the wrong answer
3:1 होना चाहिए, सेप्टल की ज्यादा होनी चाहिए। सही।
एक बार बाकी पे रीलू कर लेते हैं we have time
Is it a part of a diagnostic criteria?
no
नहीं ना कुछ, ठीक है।
late
Against
peaking
क्या है?
LVOT Doppler signal
तो सही है, तो सेप्टल तो पोस्टीरियर तो सामने है ना, सेप्टल की ज्यादा थिकनेस होती है पोस्टीरियर।
okay so the
30 seconds.
answer is B for ball
It is incorrect. The correct
Okay.
answer is D.
Yeah,
Absence
so
of
the correct
diastolic
answer is D. That's okay. I mean, you're playing well. Continue your effort. Next question.
Question number 7. His echocardiography revealed resting LVOT gradient of 35 millimeters of mercury. What is your next step? A. Septal myomectomy. B. Alcohol septal ablation. C. Beta blockers. D. Counselor for ICD. E. ACE inhibitors. The timer didn't start.
Okay,
There is a delay.
yeah, I think timer should start as soon as the question is on the screen. Yeah, okay, so it's on. So we'll have 10 seconds minus from this 1:30. So. It's 30 seconds left, so.
Answer is C, beta blockers.
The correct answer.
Okay, great, good. Let's move on.
Next. What is the risk of needing a permanent pacemaker with alcohol septal ablation? A, 2%, B, less than 2%, C, 5%, D, 20%, E, 40%.
Timer on, please.
Alcohol septal.
Okay, good.
So I think they should be the least one option. Definitely. नहीं वो
सेप्टम के इनिशियली पहले ऑपरेट करके देखते हैं वो और ट्रीट करते हैं उसके बाद
अल्कोहल सेप्टल एब्लेशन में कम होता है और either less than 2 इसमें तो तुक्का लगा I think it's less than 2.
30 seconds left.
So answer is A.
The answer is incorrect. Correct answer is 20%.
Okay, so
And
correct
before
answer was
moving
D.
forward,
Next.
we cannot see the screen like of the opponent team. So
20 become थे ही नहीं. So
Yeah. Okay, can you, it should be there when you, we should be on your side. You need to change the format where your screen is. I think it should come on the side and it should highlight
it
when
was
they
showing
speak.
before, but for the last two questions, we are unable to see that.
Okay, is there a Teams Wilson person there? Can you sort it out with them?
Yes, sir, we are doing it.
Okay.
Is it okay now?
No.
Can you see all the other screens or it's just
No,
that?
I can see. No, now Professor Dr. Khaber's screen is visible, and now our own screen is visible, but we cannot see the
Opponent.
Okay, so when anyone would speak, I suppose that screen would become, I mean, there'll be a yellow kind of ring around that and it becomes more prominent. So it should be there. So can I request Kings, when they are discussing, I mean, they can do it a little loudly so that, I mean, Mike picks it up and then their screen will be there on there. So, okay, can we move on to the next question?
okay, sure, sir.
Question number 9. Which of the following is not associated with increased risk of sudden cardiac death in these patients? A, cardiac arrest or spontaneous sustained VT. B, sudden cardiac death in first-degree relatives. C, non-sustained VT. D, late gadolinium enhancement on CMR. Or E, hypertensive response to exercise.
न्यू गाइडलाइन सेट गया है
सस्टेनेबिलिटी है क्या?
हाँ yes non sustainability is right say cardiac arrest spontaneous sustainability is right sudden cardiac death in the first degree relatives is again right late gadolinium enhancement on CMR say I think is should
It's
be the answer.
hypotensive responsive to
Yes I think it's hypotensive
abnormal response है,
Abnormal
लेकिन ये शायद
response.
उसमें से निकल गया है.
because
Yeah,
abnormal response.
you
The reason is
indication से
because,
निकल गया
because
जिसमें we
usually
have
we
to
get
think about
hypertensive
it.
when we just exercise.
Yes hypotensive
Normally we
response
get
hypertensive.
hypertensive when we
So
It's a
I
normal
think
response, but the point
whether
is
it's
that
hypertensive
whether that
response
was
to
increased risk for
exercise.
sudden cardiac death or whether that is like considering for ICD even blue chart.
risk of sudden cardiac death in these patients. ये सब दो चार्ट ज्यादा आ रहे हैं yes I'm also fixating on E.
वाला जो ना शरीर
You are
में
confused with
गया था.
non-sustained. It's hypotensive response to exercise basically.
So it's
25
consensus right
seconds.
Uh,
Yeah, E.
okay so the answer is E hypertensive response to exercise.
This is the correct answer.
Okay, great. So that's great. We now have 36, I think, marks. We'll last question now. So can we move to the last question?
All right, question number 10. Which of the following statement is true regarding natural history of disease? A, clinically manifestation is mostly after 40 years of age. B, more than 30% of patients will progress to end stage HCM. C, annual mortality rate in HCM is more than 3% in adult patients. AFib occurs in 30% of HCM patients. E, sudden cardiac death occurs only in patients with resting and provocable gradients.
Wrong.
A is
Clinical
wrong
manifestation,
because
yeah,
A
ये
is
value
wrong.
हमारे पास जो है
sudden
वो
cardiac
आपके
only in
पास
patients with resting and probable
A and E
gradients.
wrong. सबका equal.
A का तो wrong है.
E, let's exclude E as
किसी
well.
में भी हो सकता है
Yes.
ना.
Now that's B, C or D.
अब B, C, D का आ जाओ. More than 30% of patient will progress to end stage. 3% and 33 का figure है हर चीज में.
Yes, everywhere is 3. AFib of in more than 30% with HCM.
Mortality
इतनी होती 33% is quite high and the mortality is 3% in the patient. I'm not sure.
It's not about mortality. It's about progress to the end stage.
progress to end
Excellent.
stage.
Option C की बात कर रही हूँ. Annual
More than
mortality.
3% death. I'm
Yes.
sure you come into mortality most likely. Not, I don't think so.
Is either B or D?
नहीं, no, actually what happens that Hokam itself is a rare sort of thing. Na?
Yeah.
So I'm not very sure it should not be C.
There at least.
What about the AFib?
Okay, it's AFib.
It's B or D. I don't think.
Would B or D?
Okay, 30 seconds.
I think end stage HCM का थोड़ा ज़्यादा रेशियो होना चाहिए. Either C or D.
A should come.
C or D?
D for doctor.
D.
D.
D. मेरे हिसाब से D
So
है.
10 seconds.
Okay, so answer is D. Atrial fibrillation occurs in 30% of HCM patients.
This is correct answer.
Yes.
Okay, great. I think well done. You have 42 marks, I think, total, as it's shown on the screen. So great, well done. So comments from Professor Isaac, and we can then run that video if you want to, Hamza, and then we move on to the next round.
Thank you, Howard. It was a very interesting session, and I think the team has done very well. One or two questions were quite straightforward and common sense questions, but there were some tricky questions as well. So I think I would like to compliment them for achieving 42 marks, and I think that was not a bad score at all. So very well done, NICVD team.
Thank you so much, sir.
Thank you.
And now we wait for the other team. I think the timer was also going well, and everything went very smooth. So I'm very glad to see that everything has, in the first session, I think we have done very well. Thank you, Howard, for moderating.
Thank you. I think a good thing is we have kind of covered the whole Hokam. So, I mean, you're ready. Any question about Hokam? So I think both teams would know about it now. So that's great. This is what the purpose of this whole event is. And NICVD Kings, now they have a target. They know the target to win this match. So Hamza, are we going to run that video or we move on to the next round?
We're having some technical issues. The voice is not audible.
Okay, so that's okay. Let's we've already, I mean, kind of few people have seen the faces. I mean, so they are all well-known people. So maybe we'll do it less time. So we move on to the second innings. NICVD Kings are going to be presenting the case, and PIMS Leopards would be answering same round as you've already seen. 10 questions and 90 seconds for each question. So NICVD Kings, your case should be on. So please go ahead and present the case and then move on.
So should we start?
Please do.
Yes, sir.
Okay, so it's a 60-year-old male visited your clinic. He had cabbage 10 years back, ICMP with baseline EF of 20 to 25% since last 2 months. He has deteriorated progressively with 3 admissions during last 4 months in heart failure unit. His blood pressures are now dropping, due to which RAS inhibitors were stopped. He is constantly complaining of lower back pain and puffiness around the eyes, especially in morning. On examination, his vitals are blood pressure of 88/60 millimeter of mercury, heart rate is 72, irregularly irregular, respiratory rate is 19 beats per minute, saturation is 94% at room air, and bilateral pedal edema is positive. On examination, chest is clear with normal vesicular breathing. Abdomen shows hepatosplenomegaly. There is S1, S2 audible, no added sound and any murmur. ECG showed atrial fibrillation with non-specific conduction delay of about 130 milliseconds. Echo showed inferolateral akinesis with the EF of 35%, LVH of 17 septal thickness.
Next.
Okay, should we move to the first question?
Yeah,
Okay.
okay, move on to the questions.
What's the next best step in management? CRT, that is cardiac resynchronization, implantation, up titrate of heart failure treatment, or consider for LV assisted devices, coronary angiography to see grafts, cardiac CT, and option E is serum or urine immunofixation and serum free light chain ratio.
Okay, timer, please. Yes. Okay, timer is on. So
और आपका जो है वो भी ज्यादा ना वॉल थिकनेस आपकी ज्यादा हो गई है और पफिनेस है हाँ पफिनेस
है तो सीआरटी
नहीं सीआरटी तो आपको नहीं पता हाँ और दूसरा नॉन स्पेसिफिक कंडक्शन डिले है ना तो सीआरटी तो आपका आउट हो गया ना हाँ एलवाइट का भी क्राइटेरिया नहीं होता क्या कुछ क्योंकि कि चेस्ट पेन एनजीओ में नहीं चेस्ट पेन नहीं हो रहा उसको कोई सिम्टोमेटिक नहीं है नॉन आईसीएमपी का पेशेंट है
सबसे नॉन वो ये ई वुड बी दैट व्हाट डू यू से
क्वेश्चन देखने के बाद
लाइट चेन वो बैक पेन की जो कंप्लेन कर रहे थे पफिनेस के लिए एमराइड से मल्टीपल मायलोमा वाले वो जो दे रोल आउट करनी चाहिए
एलवीएच है और साथ वो भी है ना सब थिकनेस पे एज भी ज्यादा है
इनिशियली आई थिंक वही रोल आउट करनी इनिशियली क्योंकि फिर वही सारा
फिजिबिलिटी में चेस्ट क्लियर है और
मतलब कि हार्ट फेलियर कोई तो नहीं आ रहा ना वो इसकी वजह से आ रहा है कि उसकी मतलब कि सेकेंडरी प्रॉब्लम इशू तो इम्यून
30 seconds
सीरम इम्यून हाइपोटेंसिव क्यों हो रहा है
डेस्ट्रल डिसफंक्शन है पहले आईसीएमपी और फिर वो भी नहीं साथ आ रहा
क्योंकि बैक पेन सारा मल्टीपल माइलोमा की तरफ बढ़ता जा रहा है
ओके विल गो विद द आंसर ई
Okay, so E is correct.
Okay, okay, good start. That's it. Let's move on to the second question.
Question number 2 is, considering the diagnosis, which of the following echo features is most likely to present in this patient? A, relative apical sparing in 2D speckle strain echo. B, ratio of apical longitudinal strain by average of mid and basal strain is less than 1. C, rarely thickening of valves and interatrial septum. D, reduction in global longitudinal strain in later progression of disease. E, echo features cannot differentiate disease from hypertension.
Basically A correct because ये amyloidosis है तो amyloidosis में apical sparing होती है sharing and spot appearance और echo strain पे
और वो जो longitudinal strain और mid और basal strain जो है
global longitudinal strain global तो नहीं होगा लेटरल फॉर्मेशन होती है
Apical spring
लेटरल
नहीं?
लेकिन इनिशियली तो वही होगा ना लेटरल एपिकल स्प्रिंग
इनिशियल नहीं पूछा उन्होंने, मोस्ट लाइकली पूछा है।
नहीं रिलेटिव नहीं इनिशियली रिलेटिव एपिकल स्पेयरिंग जो है ना वही कैरेक्टरिस्टिक है उसकी अगर इन लेटर केस में हमें नहीं पता कि वो प्रोग्रेस करता है आई डोंट नो एग्जैक्टली
Why not see?
Huh?
Amyloid
Ready.
really technique of health in atrial septum atrial septum तो होता नहीं है वो तो तीन मतलब एक enlarged bilateral enlarged atrium होते हैं ना अगर ये restricted disease वाला पेट्रो नहीं होगा तो तो थिकन होगा ही नहीं
ग्लोबल
Deposits everywhere. मतलब ये कि
तो एक फीचर डिफरेंशिएट हो सकते हैं ना हाइपरटेंशन से मतलब
ये
ये
तो हम कर सकते हैं, ई तो आउट है ना,
ई आउट है और सी भी आउट है ना तो वो थिकनिंग तो नहीं होगी वो तो मतलब है कि
रेयरली थिकनिंग हो गया है।
It's almost 20 seconds now.
एमाइलोइडोसिस का अगर हमने कंसीडर करना है तो आई थिंक
A is
ए
Okay, we will go with the answer A.
Okay, so A is correct.
Okay, great, good. Let's move on.
Okay, so considering the diagnosis regarding Doppler echocardiography, which of the following is correct? A, restrictive mitral inflow with striking E dominance and short deceleration time in restrictive cardiomyopathy, but not in constrictive. B, respiratory variation is high in restrictive cardiomyopathy. C, respiratory variation becomes more prominent in constrictive pericarditis when left atrial pressures are elevated. D, annulus reversus is seen in restrictive cardiomyopathy. E, hepatic venous flow is in constrictive pericarditis showed reversal during expiration while during inspiration in restrictive cardiomyopathy.
B out है, ठीक है। और
ई का जो है ना ई का हेपेटिक वेनस इन कंस्ट्रक्टिव में ना वो भी आउट है वो इंस्पिरेशन में ज्यादा होती है
हाँ
रिवर्सल होती है ना
हाँ
कंस्ट्रक्टिव में तो वो भी आउट हो गया ना
नहीं कंस्ट्रक्टिव नहीं रिस्ट्रिक्टिव
नहीं कंस्ट्रक्टिव नीचे ई
नहीं
हेपेटिक
ड्यूरिंग
वेनस फ्लो इन कंस्ट्रक्टिव pericarditis शो रिवर्सल ड्यूरिंग इंस्पिरेशन होगा ना
हाँ
वो होती है
while during expiration
हाँ और इसके
नहीं
बाद
तो वो ये कह रहा है कि during expiration while कंस्ट्रक्टिव में during inspiration होती है ना,
कंस्ट्रक्शन में तो इंस्पिरेशन की होती है ना तो उन्होंने एक्सपायरेशन लिखा हुआ है तो वो ठीक नहीं हुआ
ठीक हो गया।
और डी भी आउट हो गया
हाँ
ठीक है और
रेस्पिरेटरी वेरिएशन रिस्ट्रिक्टिव से ज्यादा उसमें होती है जहाँ तक मुझे याद है कंस्ट्रक्टिव में
कंस्ट्रक्टिव में होती है लेकिन वो एक में एक्सपायरेशन में होती है दूसरे में इंस्पिरेशन में होती है जो मुझे याद है तो कंस्ट्रक्टिव में इंस्पिरेशन में होती है और ये तो आउट हो गया नीचे ई और डी और रेस्पिरेटरी सी जो है ना
इट्स स्ट्राइकिंग ई डोमिनेंट ए ठीक नहीं है,
मुझे
ए
ए लग
ठीक
रहा
है
है ई डोमिनेंट शॉर्ट डिस्लेशन टाइम इन restrictive capacity but not in constrictive
short deceleration
I'm
time
not
below
sure
is
exactly इस तरह है
in restrictive cardiomyopathy but not in constrictive.
respiratory variation is high in restrictive cardiomyopathy restrictive और कंस्ट्रक्टिव में नहीं होती ना
मेरा तो ख्याल ए ठीक है।
15 seconds left there.
जल्दी अली ए we will go with the answer A.
Okay, so it's a wrong answer. The right answer is E.
So I think it was kind of a little tricky question. E में उन्होंने I think the way the words were, you had to be very clear about restrictive and constrictive patterns. So that's okay. Let's move on.
इंस्पिरेशन में
Next
So
question.
you ordered cardiac MRI to make a definitive diagnosis. Which of the following CMR findings will be present in your patient? A, relative LA over RA volume ratio is less or equal to 1. B, global longitudinal strain is reduced. C, ventricular interdependence is more than 11%. D, pericardial enhancement is seen. E, all of them.
D भी नहीं है और B भी नहीं है।
B भी नहीं है B भी नहीं है.
ग्लोबल लॉन्गिट्यूडनल स्ट्रेन तो नहीं रिड्यूस ना, एपिकल स्पेयरिंग है ना,
हाँ
और पेरिकार्डियल एनहांसमेंट तो कंस्ट्रिक्टिव पेरिकार्डिटिस में होती है ना, इसमें तो आपकी
डिपेंडेंस होती है ना
इसमें वो होती है एल आर ए वॉल्यूम रेशियो का क्या है,
जब आपका डायस्टोलिक
हाँ हाँ सही है ठीक
LA
है
लार्ज होगा LA to RA रेशियो ज्यादा होगी जब आपका डायस्टोलिक डिस्फंक्शन होगा
उन्होंने लिखा है एल ए टू आर ए वॉल्यूम रेशियो इज लेस और इक्वल टू 1।
नहीं तो ये भी आउट है कि LA is supposed to be large as compared to RA.
नहीं वो तो अभी इसमें तो इंटरडिपेंडेंस में तो कंस्ट्रक्टिव में ज्यादा होती है ना 11%।
नहीं दोनों में
नहीं
होती है, मैं
डायस्टोलिक
एग्जैक्ट
डिस्फंक्शन जब भी होगा तो LA
वेंट्रिकुलर
large होगा.
इंटरडिपेंडेंस होती है, मुझे एग्जैक्टली फिगर्स नहीं
वेंट्रिकुलर इंटरडिपेंडेंस तो कंस्ट्रक्टिव में ज्यादा होती है ना क्यों बाहर से बंद होता है और इधर से रखते हैं।
इसमें भी तो आपका वो बिल्कुल पैटर्न सेम आता है, वेंट्रिकुलर इंटरडिपेंडेंस होती है इसमें भी,
तो फिर उनका
परसेंटेज मुझे एग्जैक्टली नहीं याद।
लेकिन उसमें ज्यादा होती है, I think इसमें कम होती है, इस तरह का कुछ है.
Or exact
It's
percentage?
30 seconds.
B out है,
B out है.
B भी out है.
हाँ.
So I think वो वजह से. तो फिर
जल्दी.
I think A ही होगा, मतलब दोनों large होते हैं तो.
ठीक है.
लेकिन इतना difference होता नहीं है उसमें. One या this.
C. जल्दी.
A तो नहीं हो सकता है, तो C देखें. C.
We will go with C.
Okay, so it's a wrong answer. Right answer is B.
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 Okay,
B for ball.
B.
Global longitudinal strain studies. Yes.
Yeah. So,
We don't have
okay, great.
for
I
wrong
mean,
answers के बाद leaders
you have to kind of make an effort. You have to be answering correctly most of the questions now. Next question.
You performed catheterization to see invasive hemodynamics of your patient. Regarding cath lab data, which of the following will present in your patient? A, discordant respiratory change in LV and RV pressures. B, hello. B, RAP and PCWP ratio is more than or equal to 0.77. C, inspiration lowers pulmonary wage pressures and increases LV diastolic pressures. D, LV and diastolic pressure is usually higher than RV and diastolic pressure. E, none of them.
उसमें तो फिर respiratory changes same ही होंगे ना.
Inspiration pulmonary wedge pressures कम कर देगा.
I think ये देखना कि कैसे प्रोटीन बढ़ेगा, आपका pulmonary wedge pressure कम आ जाए.
हम्म.
नहीं जिस आपका inflow ज़्यादा होगा वो left diastolic pressure भी ज़्यादा होगा. That makes sense. बाकी मुझे
Right atrial pressure.
RVEDP जो है उससे ज़्यादा नहीं हो सकता LVEDP से. ठीक है.
हम्म.
और जो pulmonary
ये जो ये discordant होते हैं. A answer ठीक है. Discordant होते हैं respiratory changes LV और RV
30
क्योंकि
less than
एक
30
के
seconds.
dependence से एक के ज़्यादा होते हैं तो वो दूसरे को कर देते हैं.
सही बात है.
A ठीक है. Discordant होते हैं. We will go with the answer A.
Okay, so A is wrong. The right answer is D. That is LVEDP is usually higher than RVEDP.
Okay, just one comment on this question. I mean, for future reference, I mean, you could exclude the other, so that's why D would be correct. But statement as D should be a little different. It can't be if you have a usually higher pressure. That means that sometimes it may not be. So it's not an absolute yes. I mean, you could only have what is absolute yes. But here you could reach this point because of exclusion of the other points. So that's okay, I think. So now I think you have a little tough task review to draw the match. You will have to answer all questions correctly from now on. So let's move on.
Okay, so which of the following agents should be used to control heart rate in this patient? A, metoprolol. B, diltiazem. C, amiodarone. D, digoxin. E, verapamil.
कैसे तो फिर तो out हो गया ना हमारा.
तो नहीं लिख सकते तो ठीक है. और राइट जॉक्सन होता है तो अच्छे इसको A50 चल रहा है.
A चल रहा है.
और हार्ट क्लियर है तो
तो BP कम है ना.
तो डिजॉक्सिन
Digoxin दे सकते हैं. पेशेंट का BP कम था ना हमारा. Initial blood pressure जो था वो 88
सही है. इमेड्रोन भी नहीं दे सकते ना. वो भी बीपी वो हार्ट फेलियर में तो कॉन्ट्राइंडिकेटेड नहीं है लेकिन बीपी में तो वो भी कॉन्ट्राइंडिकेटेड
नहीं वो इतना ज्यादा बीपी कम नहीं देता.
नहीं करता है. एक मिनट होता है डी उसके हमने ऐसे में कम की थी.
हाँ.
ये डी में
नहीं एज तो बंद बीपी तो वैसे ही लोअर साइड पे है ना. 88/60 है उसका तो वो कम है.
डी होगा. एफएम में है लेकिन बीपी कम है ना. बाकी दे नहीं सकते. बाकी सारे कम करेंगे.
नॉन स्पेसिफिक इंट्रावेंट्रिकुलर डिले है.
नहीं डी देंगे इस पेशेंट में. बीपी कम है बाकी कोई नहीं दे सकता. हाँ लेकिन इसका रीनल फेलियर जो नहीं है
creatinine ने mention किया।
क्रेट मेंशन नहीं
बोलना मैंने आंसर।
10 seconds left. So
D.
Is it B or D?
D. Digoxin.
Okay, so it's wrong answer. The right answer is C, amiodarone.
oh, okay. So what it appears now is, I mean, just a question to Hamza here. According to our rules, would there be, would the total numbers matter, or it's just winning or losing?
I think logically total numbers should matter.
Yes, sir.
Okay, because I think unfortunately PIMS have already lost the match because they've correctly answered 4, so they can't win the match. But we can go through the questions quickly.
I think we should
rather than
complete the
waiting for
exercise.
waiting for 90 seconds. We can go that quickly so that we cover the disease. I mean, restrictive cardiomyopathy
right.
would be covered, right?
Yeah,
Okay,
I agree.
So
I think
let's go. Go ahead. But
however, we should complete the session.
Yeah, I mean, what I'm saying is we don't have to run the timer. Just start the question and they can quickly answer, and we can then move on to the correct answer. Okay, let's move on.
So the next question is, which of the following is best predictor of long-term survival in your patient? A, ratio of early and diastolic waves of mitral valve. B, glomerular filtration rate. C, troponin. D, beta 2 microglobulin. E, presence of circulating plasma cells.
D.
Okay, so it's the wrong answer. The right answer is C, troponin.
Yeah. Okay. Next question.
Regarding. Okay, so the next question is regarding diagnosis. Which of the following is incorrect? A, it is caused by amyloid fibril deposition in the extracellular space of heart. B, common types include transthyretin and light chain amyloidosis. C, wild type amyloidosis, also known as senile amyloidosis. D, hereditary amyloidosis, H8-TTR amyloidosis, autosomal dominant. And E is none of them.
B and C to correct it. B or C भी ठीक है.
Yes, C, B correct. B correct.
B तो ठीक है. C भी correct है.
B correct है.
Hereditary amyloidosis autosomal dominant है. X. D.
Okay, so the answer is E. None of the above. They all are correct.
Okay. Next question.
Which of the following will be least likely in your differential diagnosis? A, Fabry's disease. B, Gaucher's disease. C, Loeffler syndrome. D, radiations. And E, Niemann-Pick disease.
E.
E is the right answer.
Okay, good. So we have a correct answer here. So we can, yeah, okay, great. Last question now.
Okay, so regarding specific therapy of above mentioned disease, which one is most appropriate? A, heart transplant and ventricular assist device is mainstay of treatment. B, chemotherapy, stem cell transplant is the specific treatment of this disease. C, ICD. D, symptomatic treatment along with anticoagulation. E, no specific therapy.
B for both.
B.
B for ball or D for doctor?
B for ball.
Ball? Okay, so B is the right answer. Chemotherapy, stem cell transplant in the specific treatment of this disease.
Okay, good. So we finished the innings, and I think we have a clear winner. Question, I mean, obviously the case scenario, this restrictive cardiomyopathy more, probably I think tougher question than the one which was earlier hypertrophic cardiomyopathy. But I think I will have comments from Professor Ishaq. Congratulations to NICVD Kings from my side. Comments from Ishaq Sahab, and then we can ask questions, comments from the other panelists also. Ishaq Sahab, please.
Thank you. Thank you very much, Howard. I enjoyed the session. I think I agree with you that the question posed by NSVD and the case scenario was a bit difficult. And some of the questions were a bit tricky. And I think I would, as Empire would say, thoda sa wo difficult the. But anyhow, this was a match, and NSVD Kings are clear winners. I must congratulate them. And I think this is a very good and healthy way of discussion and provoking the answers and stimulating for further reading. So I think both cases were okay. I mean, both diseases are very important diseases that we should know, hypertrophic and restrictive. But I think yes, the losing team should not lose heart or should not give up. You see, they should make more efforts, and I think they are equally competent to score much better. So hopefully they will improve themselves. And I think I would like to congratulate once again the NICVD team. They did very well, and
Thank you,
they
sir.
produced a very sort of relatively difficult scenario and difficult questions for their opponents. So that's the fight. You see, this is how the matches are run and won or lost. So thank you very much, Khawar, for very good moderation that you have done. And I think I was a bit apprehensive as to how it will go, but it went very well. So thank you very much, Hamza, and everybody for arranging this session. I really enjoyed it.
बहुत शुक्रिया इसाक साहब for being with us from although you are in UK enjoying the nice weather there. इसमें I will ask for Dr. Feroz Mehman to make a comment, but I think मेरा एक suggestion and I think ये वाला जो session है it further re-endorses my suggestion which I had said that जो case scenario है वो जो team present करती है they should have their own case scenario, they should be presenting their own case scenario, because then I think the competition becomes more equal, because rather than getting from the pool.
Sir, these both cases are prepared by these two teams.
Yeah, I think so. We should continue the same way. I think they let the teams prepare their own questions and case scenarios. So, Dr. Feroz Mehman and then Dr. Tariq Ashar. Ji?
Yeah, I have one suggestion to make. Which was a nice presentations by both of the team, a good fight between both of the teams, and I congratulate the NICVD team, and a good moderation by Dr. Khawar. One suggestion is when we are giving marks after each of the questions, I think we shouldn't declare immediately. It should be done at the last, because if one of the team just loses interest, just like the other team has lost. So the discussion is gone, and I think both of the teams' marks should be declared at the end to have the interest throughout. This is my comment.
I think this is a valid point. Tariq, I agree with your point. I think this is valid.
Okay.
However, we should keep it to the end.
Yeah, there's no harm in doing that, although I think it's only 10 questions, so each team would know how many they have answered, so they can calculate their own numbers at the same time. So yeah, but I think I agree, we can leave it showing, not showing on the screen, and then that's okay with me. I mean, it's either way, that's okay. Dr. Feroz Mehman, you are here?
I'm here, yes. Can you hear me?
Yeah. We enjoyed your lunch, by the way. We didn't know what you were having, but you were thoroughly enjoying, so we enjoyed that too.
It was simply the same lunch which you advised. Okay. Because I have to go to another meeting now at 3:30. I wanted to finish while hearing this thing. I think it was amazing, exciting academic exercise. This keeps the students at the toe, and even it keeps us on the toe, fingertips के बहुत सारी चीजें हम सोच रहे होते हैं इसका जवाब क्या होगा. So they've done very
Rose, I
well.
can't see you.
I can't get it. I don't know what's happening, but at least आप मेरी आवाज तो सुन रहे हो ना?
आवाज सुन रहे हैं यार, लेकिन आपका चेहरा मुबारक देखना चाह रहे हैं।
पहले आ रहा था, सडनली गायब हो गया। कोई जूम का प्रॉब्लम है या वाईफाई का प्रॉब्लम है? अभी तक ये इमरान खान फिनोमिना चल रहा है, तो थोड़ा सा वाईफाई ऑफ ऑन हो रहा है, बीच में 3-4 दफा बंद हो गया। तो आई एम सॉरी कि आई वाज लिटिल बिट ऑफ इन बिटवीन, लेकिन एक बात बता दूं कि दिस वाज अ वंडरफुल प्रोग्राम। थैंक यू वेरी मच विल्सन, एंड आई थिंक among the teams both were very good and Khabar was excellent, superb above all. Thank you very much. I enjoyed it. I'm sure I will continue this program and we'll enjoy it all.
Thank you, Feroz, for being with us. Amber, you there?
Yes, Assalamu alaikum,
Yeah.
sir. Assalamu alaikum to all of you. It's really, really a wonderful academic activity. And I think so the concept was really very good. और जैसे अभी प्रोफेसर इसाक साहब ने कहा है, all the TMOs, not only they are on the show, even we the supervisors, we are answering the questions कि इसमें क्वेश्चन के फ्रेमवर्क में क्या प्रॉब्लम है या आंसर में क्या है. तो दैट इज रियली वेरी नाइस. Another important thing which I really want to endorse, the fight should be till the end, and that is really a nice exercise. And let's hope next teams कैसे play करती हैं और आगे कैसे चलती हैं. और we are really grateful and thankful to Wilson Palmer और फिरोज मेमन साहब जिनका ये कॉन्सेप्ट था, और जिसे खावर कासमी साहब ने बहुत अच्छे तरीके से मॉडरेट किया, और जिन सब लोगों ने क्वेश्चंस रिव्यू किए हैं. दैट इज रियली वंडरफुल. थैंक यू वेरी मच. थैंक यू टू ऑल ऑफ.
ओके, बहुत शुक्रिया, थैंक यू. लगता है सारे नंबर मेरे ही हो गए हैं, बट आई थिंक एक्चुअली द हीरो ऑफ द और विनर्स ऑफ द टुडेज इवेंट आर NICVD Kings. So congratulations again, and congratulations to PIMS Leopards as well for fighting it out. They've done very well. So I mean, a clap for Leopards and Kings, both of them.
Thank you, sir. Thank you.
बहुत शुक्रिया. And at the end, I think thank you, Wilson. जी Feroz.
I would like to congratulate NICVD Kings. They did very well. I think PIMS were doing also good, but वही बात तारिक वाली बात है, जब मार्क्स आ गए तो थोड़ा सा परेशान हो गए कि अभी आखिरी ओवर जो वो डेंजरस है. So I think they sort of gave in, but they did very well. Both teams did very well, and I'm sure they will get further chances and will go on.
Sir, I just want to ask one question. Like in this team, we really congratulate NICVD. How they go? This is the first round, and then in the second round they have a competitions with the other one.
Yes, Hamza, please,
Yes,
can you answer that?
And also, is there any prize for the winning team?
Yes, we do have a prize, sir. I want to answer Dr. Amrasha first.
Isaaq sab, prizes हम announce कर चुके हैं. It's over 300,000 first prize and 150 second and 100,000 third prize. And all teams will participate group matches. At the end of the day, the two teams from the group matches will go to semi-final in both groups, and then in the end they'll have finals. So the team will, I think, get more chances to play as well.
और मॉडरेटर के लिए क्या प्राइस है, वो आपने अनाउंस नहीं किया.
सर आपके लिए बहुत बड़ी ट्रॉफी है, डोंट वरी.
Feroz Saab, you are the Najam Sethi of this program.
Okay, I think it's already past 3, so let's finish this because my जो residents हैं वो पहले से हैं और उनको काम पे भी जाना होगा. So for final concluding remarks from Hamza, from Wilson, and thank you very much for coordinating all the event.
Sir, I just want to make one comment. PIMS Leopard have the opportunity to qualify for the next round. In Group A, we have 3 teams: PIMS Leopard, NICVD Kings, and the third team is Mayo Kingfishers. So the next match is between PIMS Leopard and Mayo Kingfisher, and 2 teams will qualify from this Group A. So they still have the opportunity for qualify for the next round. And for final concluding,
yeah, great. Best of luck, PIMS Leopards and Kings as well.
जी, मैं यही बात क्लियर करवाना चाह रही थी ताकि पिम्स जो है वो डिसहार्ट मत हो, अभी उनके फुल चांसेस मौजूद हैं यहाँ पे. That was my question. Thank you, Hamza. You have addressed that.
Inshallah. So okay, let's then conclude that. Thank you very much. आप सब लोगों का बहुत-बहुत शुक्रिया. And इसाक साहब,
what about the next match?
Next Saturday.
Okay.
Next Saturday.
जी, तो बहुत बहुत शुक्रिया एवरीवन, बहुत शुक्रिया, एंड अगेन कंग्रेचुलेशन टू बोथ द टीम्स, एंड इंशाल्लाह वी विल बी सीइंग यू अगेन लेटर ऑन. Thank you very much.
And sir, thank you very much.
Thank you so much.
Thank you
Thank
very
you so
much,
much.
sir.
Assalamu alaikum, everybody.
I'm missing
Yes,
all
sir.
of you being abroad, but thanks to Zoom that we are connected.
Great.
सर आपको देख के बड़ा अच्छा लगा, मजा आया, गरम गरम बैठे हैं।
हैदराबाद में टेम्परेचर आज 44 है सर।
इसमें
अच्छा,
आप
अच्छा।
भी गरम बैठे हैं और इसाक साहब भी गरम बैठे हैं, पर डिफरेंट मौसम में, डिफरेंट वेदर में।
आप
बिल्कुल
6
सही
और
है।
कर लें तो हाफ सेंचुरी हो जाएगी. तो आज के
आई थिंक वी आर अप टू इट।
तो आज के विनर तो आप हो गए, क्योंकि 42 मार्क्स थे NICVD किंग्स के, आपके 44 हो गए हैं, तो यू आर द विनर. ओके, चलें जी, थैंक यू, खुदा हाफिज टू एवरीवन.
Thank you very much, sir. Thank you very much.
अल्लाह हाफिज़, थैंक यू।